Hi, my name is Vernon Perry. I'm a registered nurse, and this is my actress slash patient, otherwise known as my wife, Vilma. What is your name, please?
My name is Vilma Perry.
Do you mind if I give you a quick exam?
Sure.
Okay, I'm going to be touching you if that's okay. Is that okay? Yeah?
Yes.
Okay, please stop me if you feel uncomfortable or are in any pain. Okay, I'm going to go ahead and wash my hands real quick. We're in our kitchen and this is just a demonstration. Okay, the first thing I'm going to do is just go ahead, take a quick look at her mouth, eyes, and any kind of her mouth and her eyes, and any kind of a discoloration or anything like that, anything that jumps out at me, I'm just going to go ahead and note that. Okay, everything looks normal. Okay, we're going to go ahead and move on to the exam, and we're going to be doing a peripheral vascular and a lymphatic system assessment. Okay, we're going to be doing this kind of quick, okay, because it is kind of cold in here. I do have a heater set up here in our exam area. However, it is a little on the cool side. Okay, the first thing I'm going to do. Okay, this is me. Okay, here, can you take off your top for me, please? Okay, this is me. First thing we're going to do is go ahead and inspect her skin, the color, texture, and make sure that, that we're not looking at any like unusual hair or spots. Okay, we're checking for petechiae or purpura. Okay, we're looking at her fingernails. Okay, as well as her toenails down here. Lift it up a little bit, honey. Okay, we're looking for any kind of varicosities, edema, or ulcers, and okay, everything's looking good. And normally I would wear gloves, okay, but look, this is my wife and we've been married almost 30 years now, so we're good. Any stranger or like that, and yeah, you're going to see me wearing gloves for sure. Okay. We're looking for symmetry, both extremities. We're checking to make sure everything is nice and warm. You could use, it's suggested to use the back of your hand. It's a little bit more sensitive. Feet, everything seems to be okay. Yeah. Okay. No temperature differences. We're going to go ahead and look for edema. Okay, there's no edema present at all. Okay. Then we're going to go ahead and just do some peripheral pulses. Okay. Check here. Okay, pulse is fine. Okay, pulse. Yeah, we're looking good. Okay, we're going to go ahead and do the dorsalis pedis as well. So, okay, flex your big toe up here. And yeah, we got a nice strong pulse. Okay, let me see the other side. Okie dokie. And yeah. Okay, you've got sensation here. Okay, yeah.
Yes.
Okay, the other foot. Here, do you feel that?
Yeah.
Okay. Pokey, feel
Yes.
that? Yeah. What about here?
Yes.
Here, there. Everything okay here? Squeeze my hands real quick. Yeah, okay. Everything is looking fine. No ulcers, no nothing out of the ordinary here. We look around, we'll give it a quick good look. Okay. Yeah, okay, looks good, honey. Okay. Yeah, I know it's very cold. We're going to try to wrap this up for you really fast. Okay. Okay, now we're going to just go ahead and we're going to look at our cervical lymph nodes. Okay. I just want to, I got a checklist here just to make sure I'm catching everything. Okay. And we'll go ahead and check up under here, the submental. Okay. The post-auricular, pre-auricular, post-auricular. Okay. Everything feels good. Okay, we're going to look down here too. I'm going to move my hands so where I can kind of just maybe get good. Yeah, no, we're looking for any kind of bumps or swelling, any pain or anything. Okay. Okay, what about, we'll go ahead with capillary refill. Okay, that's looking good. Yeah, that's looking good, goes.
What's that?
You're just capillary refill. That's where you're just squeezing it and seeing if it comes back. The blood flows back in. If a person has a problem with their blood getting down to the bottoms of their fingers or toes, then it's not gonna. You see how you squeeze it and then it comes back right away. Okay, that's the capillary refill. Okay. Okay, we can even do an Allen test. Okay, we're going to go ahead and skip that for now, as well as look for a Holman sign. However, that's not going to be necessary because everything looks normal, and it is kind of very cold in here right now. Okay, everything here, we have normal findings. Pulses are palpable, symmetrical, and they're all graded at 2+, which is normal. The skin is warm and dry with no signs of cyanosis or pallor. Capillary refill is less than 2 seconds. No problem with the lymph nodes, no swelling, tenderness, or redness along the veins. Okay, any abnormal findings and their significance would be peripheral artery disease, would be weak or absent pulses, cool extremities upon elevation, and rubor when dependent. Okay, edema would be abnormal. Swelling of the lymph nodes, that would be abnormal. Any type of venous thrombosis, that would be abnormal, and any kind of lymphedema, that would be abnormal. Okay, well, thank you very much, and this concludes our presentation. And of course, thank you to my wife Velma. Okay, so thanks, honey.
You're welcome.
Okay, let's see how this turned out, okay? All right, hon.